Well, thank you everybody for being here. Probably like many of you, I know people who have been impacted by suicide. And this issue really hit close to home for my family in 2017 when one of my son's best friends took his own life. And we were shocked and obviously devastated when that happened. At the time, I was in the middle of my first campaign and knew that if elected, I could address student mental health issues as a policy maker. I'm Kelly Moller, and I represent District 42A in Shoreview, Mounds View, and Arden Hills. Last year, during my first term in office, I heard from people who lost loved ones to suicide. And every educator I talked to said that students were experiencing growing mental health needs. They told stories of students having a mental health crisis and being returned to their classrooms without treatment. School districts are naming student mental health as a top concern. And school support personnel, like social workers, psychologists, nurses, and counselors, have testified about how they don't have the resources to meet the needs of our students and are often forced to either put students on waiting lists or even in some circumstances turn them away. And we don't just have anecdotal evidence about this problem. In Minnesota in 2017, suicide was the second leading cause of death for teens and young people. In Minnesota's 2019 student survey, 47% of 11th graders reported that during the previous 2 weeks, they felt down, depressed, or hopeless. 62% felt nervous, anxious, or on edge. And 29% reported that they had at some point in their life seriously contemplated suicide. Minnesota ranks near the bottom of states for the ratio of students to support professionals in schools. And nationally, 1 in 6 children experience a mental health disorder each year. And despite the fact that more than half of mental health challenges begin before the age of 14, many children don't receive appropriate treatment. While there has to be a comprehensive approach to student mental health and suicide prevention, there are some specific steps that we can take. These include increasing the number of teachers who receive suicide prevention and mental health training, creating standards for that training, and helping districts create evidence-based responses to address student mental health needs. The other speakers today will describe the bills we are considering in the House Education Policy Committee tomorrow night, and they will also provide some more examples of the scope of the problem in Minnesota.
Hi, my name is Podany. I'm the Safety Services Manager and Chief of Police for the City of Blaine in the North Metro. And in Blaine this year, we've already had 6 student suicides connected to our community, 4 out of 1 school alone. And to say this is a problem is an understatement. We have our youth that are faced with mounting challenges. We've had, 25 years ago, it was hard enough being a kid. Now, we have kids that are dealing with more stressors than ever, and everything's coming at them from all angles, whether it's on their phone, whether it's their youth around them, whether it's the world we live in. It used to be we could go home, and that may be a safe haven for many problems that were happening at school. Now, with the advent of social media and so many other things in our lives, it's hard to get away from any problems. We've done a number of things up in Blaine to work in partnership with our schools, and unfortunately, this is not a police problem. This isn't a school problem. This isn't a home problem. A lot of times, problems at home are part of the problem in general. This is a societal problem. This is something that affects all of us, and this is certainly something that affects our youth to a great degree adversely currently. Our schools are educational institutions, but unfortunately, they're also having to address the mental needs of our students as well, of our youth. And our kids are spending 8 hours a day there. And the networks that they have there can sometimes be tied to the problems, but they also need to be tied to the solution as well. And that's why I think this is a very important step. These 2 bills are an important step towards furtherment of helping our youth, because that's what this is all about. So, thank you.
Hello, my name is Liv Steen, and I'm a junior at Hopkins High School, as well as a Minnesota Youth Council representative, a council that oversees legislature to make sure it represents the youth. I am here because in 9th grade, at my school, we had 2 students who committed suicide within 2 weeks of each other, and our needs for the school, for the grief that the entire school was experiencing, was not met. We had 2 counselors at the time, and I've seen this continue throughout high school where our needs continuously have not been met, even with grants and different funding from our own community.
Hello, my name's Amy Jones. I'm here representing Minnesota teachers. I've had the honor of being a licensed elementary school teacher in Minnesota for the last 28 years. I also had the honor of being an elected school board member in Mounds View for the last 2 terms. And I have seen evidence of the growing needs around mental health with our students ever since I started my career, but increasingly over the last 10 years. Currently, I have the pleasure of teaching at Bel Air Elementary in New Brighton, which is in the Mounds View School District. Over my long career, I've seen drastic changes in overall decline in the mental health of our students. We have many students that struggle with anxiety, depression, and other challenges to the point that it drastically interferes with their education. We also see a lot of unmet mental health needs with our students' parents and community members, and eventually those also impact and hinder a student's educational experience. As a teacher, I know that we need trained student support staff to help us address student mental health needs, but very often those needs are, when unmet or when you don't have the appropriate staff, funnel themselves down to classroom teachers that don't have all the training that they need to address student mental health needs. I know, myself included, that I'd like to learn more about how to respond to student mental health concerns in classrooms. We want the best for all of our students. And we know that that includes prioritizing their mental health needs and the district's abilities to respond to their mental health needs. The bills that are being put forward would drastically improve the mental health situation in my school and in all other Minnesota schools. And we're very thankful that Representative Moller has taken them and moving them forward. Thank you.
Good morning. I'm Sue Abderholden, Executive Director of NAMI Minnesota, the National Alliance on Mental Illness. And the mental health of our children and youth is worsening. We hear it from parents, teachers, coaches, and we hear it from the youth themselves, especially through the student survey. 13% of 8th, 9th, and 11th graders have seriously considered suicide within the last year, with 4% actually attempting. Among our Native American youth, it's even higher, with 11% of boys and 34% of girls in 8th grade, with around 4% of boys attempting and 19% of girls in 8th and 9th grade. And it's higher yet among our gay and lesbian youth, with 30% of males and 41% of female identifying youth seriously considering suicide. We can't just throw up our hands. These are our children. It's up to us as adults to reach out and help them. These 2 bills will move us in that direction. First, we must make sure that all teachers, not just the ones in tiers 3 and 4, have basic understanding of the early warning signs of mental illnesses in children and youth, and learn the warning signs of suicide and what to do. Minnesota was actually the first state in the country to require teachers to have continuing education on children's mental health. This was passed in 2003, and we added the requirement on suicide prevention in 2016. When the tiers for licensure were developed, the first 2 tiers were left out of these requirements, and we believe that every single teacher needs to have this information. Second, we need a point person within the Department of Education to focus on students' mental health. Districts will know who to call to obtain information about school-linked mental health, about the best trainings on mental illnesses, or the best practices about responding to a suicide in their school. It's the old story that if it's everybody's job, then it's nobody's job, and that's true here. We are reaching a crisis stage in education in schools where the children spend the majority of their day, have an important role to play, and that's why NAMI Minnesota is here strongly supporting these bills. I also want to just remind the media to go to reporting on suicide to make sure that you don't play a part in contagion.
I'm Chuck Wiger, Maplewood, State Senator. I'm the ranking member for E12 Policy and Finance. We need to act now. Ms. Aberholden referred to approaching crisis, emerging. We have a crisis. How many suicides is it going to take? How many more people falling through the crack? Or do we need to take action when it's in response to a shooting? We have the resources, and we need to act. I'm authoring in the Senate a provision which would provide a specialist in the department to get a better handle on the various programs that are available in different silos, to provide a website of information, a go-to as to where teachers and others can find more information. Representative Moller has the bill in the House. It'll be fully vetted soon, on Monday. And it's my hope that we will get a hearing on this in the Senate. I call your attention again to the need. 1 in 5 Minnesota students is impacted by mental health. It must be destigmatized. Half of these young people, our future, are not getting treatment. So let's step up and take the steps needed as identified by our officers, by providers, by teachers, and most importantly, to provide hope for these students.
So Senator Wiger talked about one of the bills, and then the other bill was referenced by some of the other speakers, and that bill is the one that's going to require all teachers to have suicide prevention and mental health training. I think Sue talked about the fact that all teachers used to be getting this training. We'd gone to the tiered system, and for some reason, tiers 1 and tier 2 were left out of that training. So we're going to make sure that those teachers are also getting the training, in addition to having PELSB create some rulemaking around what the standards for that training should look like. So with that, we are ready for your questions.
Representative Moller, some of the data you cited in your opening, where was that data from?
Yep, so I was referencing a couple different things. The school student survey, you can find that. I think it's the Department of Health that has that on their website. And then AFSP, the Association for Suicide Prevention in Minnesota, has a one-pager with some Minnesota data, and they tell me that they're going to be releasing, that was from 2017 CDC information, they're going to be releasing the most recent information, I believe, by the end of this month. So we'll have some more updated numbers for you as well. Yep.
So Roth, NPR. We have the St. Paul public school teachers talking about a strike, and their main question is about mental health and mental health support. How is this connected to those demands?
Sure. I think that what's happening in St. Paul with the teachers and the potential strike looming really highlights the crisis that we have in our schools, that there is this unmet need, so much so that teachers are talking about striking, but also the challenge that districts have in facing this unmet need.
But the bill that you're presenting, and that the two bills today are not directly tied to that.
Correct. They're not directly tied to that. And because this isn't a budget year, also they're not, these bills aren't putting more money into the support professionals, which we absolutely want to do. But because it's not a budget year, we're not focusing on that.
What's the protocol now if somebody who does have this suicide prevention training has concerns about a student? What happens? Do they refer them?
I think it varies among districts. I don't know if somebody else wants to speak to that.
I can speak to that. That's district level policy, and one of the things that's challenging about that is that you have to kind of know the ins and outs of that based on your individual school and your individual district, but the policy can differ greatly. Normally there is some kind of a crisis response team that's activated, and there's someone that you contact right away. Always if we're concerned about a student's suicidal ideations or concerns, we are always contacting authorities to provide immediate assistance, but it really varies greatly by district. So as a teacher, you have to go into a new district or a new building and make sure that you know what the protocol is.
Yep, and actually, before I forget, I just wanted to make sure that if you're reporting on this, we would really appreciate if you could also report the National Suicide Prevention Lifeline number, which is 1-800-273-8255. That number provides free and confidential support for people in distress with prevention and crisis resources. And you can also text MN to 741-741.
If there's not more money being appropriated for this, where would the money come from to fund a specialist and then more training for the teachers?
Yeah, so there is a fiscal note on it. The fiscal note for the training is very small because it's around rulemaking. The fiscal note for the director position, we're narrowing the scope of the bill right now to address the fiscal note that came back.
But this would differ from St. Paul. What they're talking about is hiring teams of professionals, and that's a budget issue.
Correct, yep. Does anybody else want to speak to that? Yeah.
Representative Cheryl, Youakim, Chair of the Ed Policy Committee. We're hearing both these bills tomorrow night because we know how important it is for our students to get the support that they need and also for the teachers to get the training that they need. Teachers are asking us for this. They're facing this in their classroom every day. And as Representative Moller said, all teachers had training starting in 2003 on this. When they did the tiered licensing system, they left Tier 1 and 2 out. And looking at data of who those teachers are, there are a higher population of teachers in Tier 1 and 2 dealing with our most vulnerable kids. They need this training too.
If I may.
Yeah.
Representative Jim Davnie, I chair the Education Finance Committee in the Minnesota House. Last year, the House passed off the floor a bill that included Support Our Students grants, a grant program that provides school districts with targeted funds for the hiring of school counselors, social workers, nurses, and psychologists. We also included in that bill specific funding for up to 40 districts to develop trauma specialists to work with those students who've experienced parental divorce, death of a parent, issues with drug addiction, child abuse, and that sort of thing, to support those students. Unfortunately, the State Senate did not share the priority of meeting the needs of today's students, and we were unsuccessful in getting those through the conference committee process. I would hope that this year we might have a different process and a different outcome.
Can you talk a little bit more about the timetable for each of these bills?
Yep, okay, so the two bills we're going to be hearing tomorrow night in the House, the Education Policy Committee, so that's going to be tomorrow evening. Those bills will have some additional stops in the House. And then on the Senate side, the chair of the Education Committee is carrying a similar bill, a clone bill, to the teacher training. And I don't know what the plan is in the Senate for that, the timing for that bill. And then the other bill as well, which I will say also has bipartisan support. Both of these bills do have bipartisan support.
Anything else?
I have one more question for Chief Podany, if I could. I know we spoke recently, you were kind of trying to stem the tide. I know it's a delicate subject and the way reporters talk about numbers and proximity. It felt like your community needed more of an emergency injection, you know, kind of as the state rep talked about, almost trauma specialists. Some of those families were concerned that they weren't getting the help. You had friends of friends of friends that were, you know, taking their own lives. Anything to update us on whether you feel you've gotten that under control in your community specifically? And
last week on Monday night, actually, Youakim School District did have a mental health forum where it was so well attended, it was standing room only in 3 rooms. It was overflowing. And I received a lot of positive feedback from that. We're continuing with our efforts underway in our community. Our school resource officers are working actively with counselors in the school and with student groups actually to involve them in the process on developing an app for students. This is something that's specific to us that we would obviously love to expand that program and work with, whether it's the Department of Education or whoever that may be on. But we like to say we're making progress, but I can also tell you I don't make it through a weekend without waiting for my phone to ring with a concerning call as well. So we're certainly, our nose is still to the grindstone, but we've been fortunate for the last couple of weeks here. So. Yeah.
Sue, do you have any advice for the media on how we should handle these outbreaks, like when there's, or Chief or Sue?
I'm going to defer to Sue.
So don't. The more that you focus on a string of suicides, the more attention that you're giving it. So it's better just to focus on overall children's mental health, overall the resources that are available. But when you keep focusing on that, you put too much attention on it, and you can, in fact, promote contagion. So you need to be extremely careful when you're reporting on it. There is one other resource I want to mention to make sure is in Minnesota we have what's called school-linked mental health, where grant money goes to a community provider who then co-locates in the school, works with the school support personnel, but they can actually diagnose and treat children as well. We're in about 50% of the actual school buildings in Minnesota, but nowhere near reaching and addressing the need.
Hi, I'm Cassandra. I'm with the American Foundation for Suicide Prevention, and I just want to speak in regards to your question. There are some really good guidelines. I know, so if you do choose to report on it, as Sue mentioned, find those resources. If you don't have them, ask one of us and we'll just send it to you, but there are some good ways to handle that reporting.
Thank you. Thank you.